Good morning, everyone. Welcome to today's session. I'm delighted to have you here. Today, we are going to explore an important topic. What is quality? This is the first slide, so I'd like to start by introducing myself. Dr. S.K. Singh, PhD. We will discuss the concept of quality, why it matters, and how it impacts various aspects of our work. So, let's dive in and begin this insightful journey together. Let's take a closer look at what we mean by quality. When we talk about quality, we're referring to several key aspects of a product or service. First, there's Q for quality, which relates to the actual characteristics of the product itself. Then, we have C for cost, which involves the characteristics related to the price and overall cost structure. Next is D for delivery, covering aspects like quantities, timing, and lead times that impact how quickly and reliably we get the product to where it needs to be. Lastly, S stands for services, which are the issues or problems that might arise after the product has been shipped and are part of the overall customer experience. Now, the four aspects of quality, Q, C, D, and S, help us understand that quality isn't just about the product itself, but also about cost, delivery, and after-sales service. When we define quality, we often say it's compliance to the best known standards, processes, and specifications. Essentially, it's about making sure everything is done according to established guidelines. Another way to measure quality is through conformance to requirements, meaning, does the product meet the specifications it was meant to? But perhaps the most useful and straightforward business definition of quality is that it's fit for purpose. In other words, the product or service should do exactly what it's supposed to do, fulfilling the needs of the customer. So, in the broader context of our presentation, understanding these aspects helps us see that quality isn't just a single metric, but a comprehensive approach to ensuring customer satisfaction and operational excellence. When we look back at the concept of quality, especially in the ancient and classical eras, it's fascinating to see how it was primarily viewed through the lens of excellence and craftsmanship. Aristotle, who lived in the 4th century BC, offered a foundational perspective by defining quality as that in virtue of which a thing is said to be such and such. Essentially, he was highlighting that quality relates to the intrinsic nature of a thing, what makes it what it is. During that time, the focus was very much on the excellence of the individual craftsperson and the durability of their work. It wasn't about systems or processes, but about the skill and mastery of the artisan. The idea was that quality depended heavily on personal skill, on the artisan's ability to produce something of lasting value and true craftsmanship. So the key takeaway here is that, in this era, quality was closely tied to personal skill and excellence. It was about individual mastery, a concept that laid the groundwork for understanding quality long before modern systems or standards emerged. This historical perspective helps us appreciate how the notion of quality has evolved, but still retains that core emphasis on skill and excellence. So, when we look at quality during the early stages of mass production, it was primarily focused on inspection and conformance. As production volumes increased, we saw a rise in defects, which made maintaining quality more challenging. The approach back then was to ensure quality mainly through inspection after the products were already made. If a product was defective, it was simply rejected, so the focus was on catching errors rather than preventing them in the first place. In essence, quality was understood as meeting the product specifications, but only once the product was finished and checked. The key idea here is that, during this period, the goal was to detect defects, not necessarily to prevent them from happening in the first place. This mindset was very much rooted in the Industrial Revolution era, roughly from 1900 to 1930, when mass production techniques were rapidly evolving. It's important to see how this historical context shaped the way quality management was approached, mainly reactive, focusing on inspection rather than prevention. Let's delve into the concept of quality as controlled variability. Walter A. Shewhart was a pioneer in this area, introducing the idea of statistical process control, or SPC. What this meant was a shift in focus from merely inspecting products at the end of the line to actively controlling the process itself. This was a significant evolution in how we approach quality management. Schuhart believed that quality isn't just about measurable attributes. There's also a subjective aspect, which is how customers perceive the product or service. So, quality has both an objective, measurable side and a subjective, customer-focused side. The key takeaway here is that to achieve consistent quality, we need to control the process itself. If we can manage the process, we can ensure the quality remains stable and predictable over time. This is the foundation of the statistical quality control era, which spanned roughly from 1930 to 1950. During this period, the emphasis was on developing statistical tools and methods to monitor and control processes. This was a game changer because it allowed for proactive management of quality rather than reactive inspection. So, in essence, controlling the process is the best way to control quality, and this approach laid the groundwork for modern quality management systems. Let's talk about customer satisfaction as a key measure of quality. When we think about what contributes to quality, three major figures stand out. First is W. Edwards Deming, who believed that quality means predictable uniformity and dependability, all while keeping costs low and matching market needs. Then, we have Joseph M. Jurin, who defined quality simply as fitness for use, meaning the product or service should meet the customer's intended purpose. And finally, Philip B. Crosby, who emphasized that quality is conformance to requirements, ensuring everything meets the specified standards. A crucial concept here is that quality should be customer-focused, meaning we aim to prevent issues before they reach the customer, rather than relying solely on inspection after the fact. This shift towards prevention is essential for building trust and delivering real value. Now, if we look at the post-war period from 1950 to 1970, this was a time when these philosophies really started to shape the way industries approached quality. It marked a move away from just inspecting products at the end of the line to embedding quality into every part of the process. This era laid the foundation for modern quality management, emphasizing prevention, consistency, and customer satisfaction as fundamental goals. When we talk about quality, it's important to remember that it's not just the responsibility of a single department. It's an organization-wide commitment. Quality involves people, processes, and the culture of the entire organization working together. A key concept here is continuous improvement, often called Kaizen, which means always looking for ways to do things better. This mindset requires strong management commitment because leaders set the tone and support ongoing efforts. Now, let's define total quality management, or TQM. It's about meeting customer requirements through continuous improvement, and importantly, involving every employee in that process. Every person in the organization plays a role in delivering quality. The overarching idea is creating a quality culture, where continuous improvement is part of the daily mindset, and embedding it throughout the organization. And just to give you some historical context, the TQM era from 1970 to 1990 was a pivotal time when organizations embraced these principles to enhance their competitiveness and customer satisfaction. When we talk about quality, it's important to understand that it's really about the overall set of characteristics that define an entity. According to ISO 8402 from 1994, quality is the totality of these characteristics, especially those that influence an entity's ability to meet both stated and implied needs. Basically, it's not just about what's written down, but also about what's understood and expected. Moving on to the ISO 9000 series, which has played a major role in standardizing quality around the world. This series emphasizes the importance of documentation, traceability, and maintaining consistency across processes and products. Why is this important? Because having documented procedures and traceable records helps ensure that quality isn't left to chance. It creates a systematic approach to quality management. A key concept during this era, which spans roughly from 1990 to 2000, is system-based quality assurance. This means that instead of focusing solely on individual products or inspections, organizations began to look at the entire quality system as a whole. It's about creating a comprehensive, interconnected approach that guarantees quality across all stages. Overall, this era marked a shift towards viewing quality as a structured, system-driven process, supported by international standards, which helps organizations deliver consistent and reliable results. And this sets the foundation for the broader theme of integrating quality into every aspect of operations. Let's talk about quality, which combines compliance and risk control. This is especially crucial in pharmaceuticals and medical devices, where product safety and effectiveness are paramount. We'll look at some key guidelines introduced by the International Conference on Harmonization, or ICH, to help ensure quality across the board. First, ICH Q8 focuses on pharmaceutical development, emphasizing a thorough understanding of product and process development. Next, ICH Q9 is about quality risk management, which helps us identify, evaluate, and control risks to quality. And then there's ICH Q10, the Pharmaceutical Quality System, which provides a comprehensive framework for managing quality throughout the product lifecycle. Now, from a regulatory perspective, quality means ensuring that our products are safe, effective, and consistently meet predefined specifications. It's about building trust with regulators and patients alike. The key concept here is that quality is fundamentally linked to patient safety and regulatory compliance. Over the period from 2000 to 2010, there was a clear shift towards a risk-based approach and a focus on regulatory quality. This means proactively managing risks and aligning our quality systems with regulatory expectations to ensure we deliver safe, effective products consistently. Let's dive into ISO 9000, 2015, and what it really means for quality. Essentially, quality is about how well a set of inherent characteristics of an object meet the requirements. It's not just about being good or bad, but about fulfilling specific needs and expectations. Now, the key features of this standard include risk-based thinking, which encourages us to proactively identify and manage risks to ensure consistent quality. Leadership accountability is also crucial. Leaders need to take responsibility for creating a quality culture. And performance-based systems mean that we focus on actual results and continuous improvement rather than just processes on paper. The most important concept to remember here is the connection between performance, risk, and value creation. When we manage these aspects effectively, we're not just meeting standards, we're actively creating value for the organization and our customers. This modern definition from 2015 emphasizes a more integrated, proactive approach to quality management, aligning with today's focus on sustainability and long-term success. So, it's all about ensuring that quality isn't just a goal, but a fundamental part of how we operate and deliver value. When we look at our current understanding of quality in 2025, it's about more than just meeting standards. It's a proactive, risk-based approach that ensures our products and services consistently meet customer, regulatory, and patient requirements throughout their entire life cycle. This means we're not just reacting to issues, but actively preventing them through robust systems, maintaining data integrity, and fostering continuous improvement. Quality today is closely tied to life cycle assurance and data integrity. We're integrating concepts like quality by design, or QBD, which means building quality into our products from the very beginning. Data integrity, especially following the ALCOA Plus principles, guarantees that our data is accurate, consistent, and reliable across all processes. Additionally, digital tools like electronic quality management systems, or EQMS, help us streamline and digitize quality processes, making them more transparent and efficient. Continuous process verification, or CPV, allows us to monitor and verify process performance in real time, catching any deviations early. And of course, we're leveraging artificial intelligence and automation. These technologies enable us to predict potential issues before they happen, making quality more predictive, digital, and patient-centric. The key concept here is that quality is evolving into a predictive, digital approach focused on the patient. As we move through the era of digital and pharma between 2020 and 2025, our goal is to integrate these advanced tools and methodologies to ensure we deliver the highest quality, safest, and most effective products possible. For further support, please feel free to contact us. We're here to help you with any questions or additional guidance you might need. Thank you so much for your attention and engagement throughout this presentation. Remember, we're committed to supporting your success, so don't hesitate to reach out.